Not just looks different. We're gonna be your CNA for today, and I'll be giving a modified bed bath that'll get you. Alright, I'm gonna start by providing privacy to my patient. Come over here and wash my hands. Alright, I'm gonna start by rinsing my hands, making sure I don't touch the sink at any time. Alright, then we're going to lather. We're going to do this for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Make sure I clean under my fingernails. Making sure I get my wrist. Then I'm going to rinse, making sure my hands are pointing downward. Okay. I'm going to dry my hands starting at my fingertips and working towards my wrist. Same thing on the other hand. Get that paper towel. Turn my water off. Come back in. Put on some gloves. Alright? Great. Alright. Alright. Okay, great. Alright. We're gonna start by making sure that is as low as the make sure my water's okay with my patient. She said it's okay. Excuse me. Privacy. Okay? Alright. We're gonna start by washing. We're gonna start by washing her face. We don't use soap to wash her face. Alright. Alright, we're gonna remove her gown that she has on right now. Okay.
Why did you do
We're
that?
gonna start with her unaffected arm. This side. Then we're gonna remove it from her affected arm on this side. Okay. We're gonna remove the gown, making sure not to overly expose her. Place the gown in the hamper.
Got it.
Right? Come back over. Now we're gonna start washing her face. Make sure we don't use soap to wash her face. Alright. We're gonna use different corners each time. We're going to go from inner corner and outer corner in her eye. We're gonna wash her entire face. We're gonna come back. We're gonna dry her entire face. Not gonna rinse because we did use soap. Okay? And then we are going to place a barrier underneath this arm. We can use this arm? Okay. We're going to place a barrier underneath her arm. Alright, so water doesn't get all over the place. Okay, great. We're going to start by washing her arm. This time we use soap. We're going to wash under her arms, the length of her arm, her hands, and her fingers. We're going to come back. We're going to rinse. Alright, we're going to rinse under her arm, the length of her arm, hands, fingers. And we're going to dry under her arm, length of her arm, hands, fingers. Okay, great. That's it. Alright, we're going to get my go. Cover her back up. Get my water. Get her gown. Okay. We're gonna put a fresh gown on her. We're gonna lay it on top of her. We're gonna start with her affected arm, then her unaffected arm. Okay. All right. We're gonna do unaffected arm. Try not to expose her as much as possible. All right, so lean up first, and then we're gonna tie her up back here. Okay, I'm gonna lay that down for you. Cover my patient back up. Make sure she has her call light in reach of her. Taking my basin, going back over here. All right, just gonna pour my water out. Rinse my basin. Alright, now we're gonna dry. Okay, great. Place it in its respective area. Throw this away. Come back over here. Gonna grab all my linen. Making sure not to contaminate. Place them over here. And then we're going to make sure my bed is at the lowest level. Give my patient her call signal. Remove my gloves. Wash my hands. I'm Mr. Morgan. I'll be your CNA for today, and we are going to be dressing you. Is that okay with you? Okay, great. I'm going to wash my hands. Put on some gloves. Okay. We're gonna put the shirt on you, okay? Shirt is bad. Yay. Alright, we're going to start by giving my patient some privacy. Okay, great. And we're going to remove her gown. Make sure to untie it back here. And her affected arm is her right arm, so we are going to take it off her unaffected arm first. Then we're going to take it off her affected arm. Remove the gown, making sure not to overly expose her. Don't worry about it. You're gonna put this in a hamper. She said that she wanted to wear this shirt for today. So, we're going to start with her affected arm. We're gonna start with the affected arm. Placing each side of the shirt. Okay, then we're going to start with the unaffected arm. Making sure clothes are nice and neat. Okay. Then lay her back down. Cover her back up. Making sure everything is arranged attractively. Give her a call light. Then we're going to make sure my bed is at its lowest level. Make sure my patient is comfortable. And remove my gloves and wash my hands. Is that the last one? My skill is done. That was it, right? Alright. Cool. I'm good. My name is Mr. Morgan. I will be ambulating you with the transfer bill today. Is that what we're going to do? Okay, great. I'm going to wash my hands. Put on some gloves. Yeah. No. Wash my hands. Alright, we're going to get my patient out of bed. On 3, we're going to pull you to the sitting position. 1, 2, 3. Okay. We're going to assist her with her non-slip shoe. Make sure my bed is at its lowest level and her feet are flat on the floor. Alright. We're going to place the transfer belt on top of her. Okay. Making sure that the transfer belt isn't too loose and it's not too tight and it's slightly off center. Alright. We're going to lift her up on the count of 3. I'm going to lift you up with the underhand grasp. 1, 2, 3. Alright, and then we're going to stand to the side of her, behind her. And then we're going to walk 10 feet. Alright, we're going to pivot turn. Alright, we're going to walk back. Alright, pivot. Alright, now 3, we're going to sit down. 1, 2, 3. Okay. We are going to remove her transfer belt. Shoes. Then we're going to lay her back down in the bed. 1, 2, 3. Cover her up properly. Make sure she has her collar line. Make sure my bed is down at its lowest level. Make sure my patient is comfortable. Then I'm going to wash my hand. And then we're going to start respiration. Okay, great. Alright, did we do the 9? Alright, we're going to start when hand gets to the 9, okay? We're going to raise her bed up so that, raise the head of the bed so that I can see her chest move. Making sure her chest is visible. We're going to start when we get to the 12. Alright, let's start. Stop. Alright. Lower my bed back down to its lowest level. Make sure my call light is in reach of my patient. Make sure everything is correct and clean. Want to wash my hands. Then I'm going to record.